diabetes. Blood pressure management can reduce those two accreditations. And not only that, but we have to...
I'm Margaret Maupin-Story. I have been with the health department for 46 years. I'm a registered dietitian. I'm a master's level diabetes educator, and I am a certified diabetes care and education specialist with the Madison County Health Department. I work on the state diabetes education program, which is called Healthy Living with Diabetes. It's a wonderful program. And if you have recently been diagnosed with diabetes, or if you have diabetes, call us and enroll in one of our classes, because we can help you. We can teach you about healthy eating, and the healthy eating is all good food, by the way. And we've got teach you about the importance of exercise, monitoring your blood sugar, how to cope with diabetes, because people with type 2 diabetes have a tendency to have depression. And on a daily basis, if you have diabetes, you make 200 decisions to care for yourself and your chronic illness or disease. So we want to help you. Our program is absolutely free. It's your tax dollar at work. Right now, we don't have many options in Madison County to receive diabetes education. And we will accept you from surrounding counties, whether it be Clark, Garrett. We have patients from Estill County. So we want you to come. If you are caring for an elderly parent or an elderly relative with diabetes, we can give you education for caring for them. Or if you have a grandchild or a younger person in your home that has diabetes, we can help you to understand what they're going through and how to help with their management.
My name is Laura Shelton, and I'm a registered nurse. I'm certified in diabetes education, so that's kind of my specialty area now.
Okay, so tell us about the different types. What are the different types of diabetes?
Okay, well, there are kind of 4 types that they go by. There's type 1, type 2, gestational diabetes, and pre-diabetes. The 2 main ones that we deal with here at the health department are type 1 and type 2. With type 1 diabetes, that's more of an autoimmune disease where the immune system mistakenly attacks the body's own cells. So the cells of the pancreas are attacked and a person can no longer make insulin. So that is type 1. That's the origin of it. And then with type 2, that's a little different in nature. That's more of a gradual dysfunction of the pancreas, and also insulin resistance plays a large part in that one. So maybe our pancreas is able to make insulin as long as there's not that insulin resistance going on, but the factors that bring that in can cause our pancreas not to be able to come up with that insulin anymore, and then it can kind of gradually lead to a dysfunction in the pancreases. We have diabetes self-management classes, and we teach a lot about diabetes itself so people can understand about the disease. And then we teach how to manage. Has to do with healthy lifestyle, including nutrition, activity, just stress management, all those things that can affect your blood sugar and insulin resistance. We also teach a lot about medications that are used to treat diabetes and some of the technology that's available to help people. And we try to individualize it because each of us are unique, so we do try to fit it to you. So we cover a lot of areas and we try to make it easily understandable.
My name is David Goins. I live here in Madison County. I attend the diabetes class at the County Health Department.
So, David, tell us about the classes, what you get out of it.
It's a good educational class about what you can eat, testing your blood to make sure where it's at. And it's a good encouragement to be in a group that has the same problems that you have.
So if you had to do a 30-second commercial telling your friends, I know you mentioned a friend before, about the benefits of the class, what would you say?
Well, the benefits of the class is the educational part. It helps you choose the right types of food to eat and what not to eat, and exercise, and just being educated about diabetes altogether.
I'm John Elliott.
Tell us about the diabetes class here, what you've gotten out of it.
They have been so informative. Every month when we come to the support group, we learn about new medications. We refresh on what we were taught in the first diabetes class. When I came into the diabetes class about 8 years ago for the 2-day class, one of the ladies that run the class then told me I looked like death. And she said, you were sick when you came in here, and I really was. I was sick, and like I say, I was taking 4 insulin shots a day and still couldn't manage my diabetes, and I learned how to carb count and things like that from these ladies, and now I'm down to 1 insulin shot a day. So they're invaluable. They really are invaluable to me because they've helped me so much.
My name's Ron Jones.
So tell us about the diabetes class here, what you've gotten out of it.
Enormous knowledge of diabetes. If you go from zero knowledge and you're diagnosed with diabetes, this class has been so helpful in telling you about how to count carbs, what type of foods you should eat or think about eating, some foods you can't eat, but also some things you can combine so that you're not really depriving yourself of enjoying foods that other people would enjoy. You just might enjoy them a little less, that's all. So that's what's made the class so good. The other thing about knowledge is sharing with other people. You're able to come across other folks that have diabetes and maybe they don't have the opportunity in their health department to go to a diabetes class, but you can also help them, encourage them to talk to their doctor, to talk to their health department, their nurse, or to get more help with their diabetes.